Today I want us to talk about this wonderful product, Prednisolone. Prednisolone is one product that is used to treat a wide range of medical conditions, ranging from allergies to asthma to rheumatoid arthritis. It's also used in the prevention of organ rejection for those that did organ transplant, used in the management of autoimmune disorders. So its range of use is actually very wide. But if you are using this medication for these purposes that I listed already, please, I want to beg you to do something. Stick to your doctor's prescription and never you deviate from it for any reason. This video is actually addressing those people who self-medicate on Prednisolone. A lot of us use it for management of pains and inflammation without proper prescription from the doctor. I want to beg you, repent now that you still can. Else, you'll be writing a wonderful love letter inviting diabetes to you. And trust me, diabetes will answer your invitation.
You are joking.
Did you just ask me how? Prednisolone is known to actually increase production of glucose in your liver. It's called a glucocorticoid. Yes. It's also known to increase insulin. And finally, it reduces the uptake of glucose into your fat cells and your muscle cells. By doing these three things, it increases the glucose level in your blood. So taking Prednisolone over time actually gives you Glucocorticoid-Induced Diabetes Mellitus. Does this condition remain after you stop taking Prednisolone? Yes and no. An observational study have found out that 7 out of 10 persons who had Prednisolone-induced diabetes mellitus remained diabetic even after they stopped taking Prednisolone. The other 3 returned back to normal. So if you are abusing Prednisolone, you stand a chance of becoming diabetic as a result of prolonged use of Prednisolone, especially when you already have predisposing risk factors. You're obese, you have a family history of diabetes, you eat irresponsibly, you drink irresponsibly, you do not exercise, you're living a sedentary lifestyle. Trust me, there is a likelihood that you're going to have diabetes as a result of misuse or abuse of Prednisolone. So while science, medicine has made it easier to manage diabetes mellitus, it is still better to prevent than to manage, especially when we can. So I encourage you to look into the medications that you're taking, ask the right questions, and ensure that you're not causing a problem for yourself in the nearest future. This also applies for those who are already diabetic and as a result of ignorance are self-medicating on Prednisolone. That drug could just be the reason why you're finding it difficult to achieve appropriate sugar control. Finally, for the genuine users of Prednisolone, for those who doctors have prescribed Prednisolone to use for a long time, there is good news for you. There are things that you can actually do while being on Prednisolone that will prevent you from having Glucocorticoid-Induced Diabetes Mellitus to reduce your risk for developing this condition. If you want me to talk about this, drop a message on the comment section and I will do that in my next video. Please remain safe, remain healthy, seek information, and remain blessed.